Good afternoon, class. The current event I want to share is a new law that recently passed here in California that creates a new framework on how the state wants to deliver mental health and substance use disorder services. It's called Care Court, and it emerged from the Community Assistance, Recovery, and Empowerment Act of 2022. The Care Court expands on our current laws, empowering family, friends, clinicians, first responders, and county behavioral health agencies to petition for the treatment of chronically ill, untreated individuals with a legitimate plan for their recovery or improving baseline functioning. The Care Court's aim is to help individuals with untreated schizophrenia spectrum, other psychotic disorders, or substance use disorders who represent a large portion of the homeless population. It has either already been implemented or will soon be implemented around the state through the various county behavioral health agencies. As mentioned before, those who have close relationships with these individuals can file a care petition on their behalf, which will then be presented to a judge to determine if the individual qualifies. If an individual qualifies, the individual, with an assigned care support team and representation from their lawyer, will have to come to a year-long care agreement for mental health, and this plan, which may include treatment, housing, or medicine, must be approved by a judge. If all parties can't agree to a plan, the court can make the plan for the individual. If the plan is not followed, i.e. non-compliance with medications, the individual may be placed on conservatorship, sent to a locked facility, and forced to take medications against their will. This is where the bioethical principle of autonomy is threatened, when an individual is not able to make their decisions regarding their care. As a psychiatric nurse working for San Bernardino County, I often care for patients on involuntary holds, meeting criteria for danger to themselves, danger to others, or gravely disabled. We often send them to court to prolong their involuntary hold for further treatment, or to force them to take medications against their will. So I am intimately involved with this underserved population and understand the argument for involuntary treatment versus patient autonomy. While some argue that a patient's right to self-determination is violated, in the context of chronic mental illness, I have seen firsthand the effect involuntary treatment has on patients and understand that we are advocating for them and treating them with human dignity. But sadly, after stabilizing with a few days of inpatient treatment, many are discharged back to where they came from and go back to being non-compliant, using drugs, burning bridges, engaging in dangerous behaviors, or any combination of these. Many of us in mental health want to see more positive, sustainable outcomes, rather than the revolving door our patients routinely experience due to our broken mental health care system. Now, we know homelessness, substance abuse, and untreated mental health issues are prevalent in the state, and citizens have been calling on the government to do something about it for a long time now. Now, with Care Court, the government is investing heavily in housing, mental health programs, and growing the health and human services workforce. This will undoubtedly increase our tax burden, and it has been argued that more chronically mentally ill individuals will eventually be conserved due to the chronicity and severity of their illness and an inability to comply, further necessitating the need for more treatment facilities, long-term housing, and accessible mental health programs. Only time will tell if Care Court successfully improves untreated schizophrenia spectrum and psychotic disorders while reducing homelessness and substance abuse. Thank you.